Some other state officials are taking a different tack on federal health care funding. States like Arizona say they can make health care dollars go further if they have flexibility in how programs are run. Ariana Bustos in our Washington bureau takes a closer look at so-called Medicaid waivers.
Section 1115 demonstration waivers allow states to expand and experiment with their Medicaid programs. But Arizona has operated its Medicaid agency through an experimental program for 36 years. 99.7% of the state's Medicaid expenditures are now spent on programs run under such waivers. Tom Betlock, director of Arizona's Medicaid agency, says that's because it works.
We have one of the lowest costs in the United States, well below the national average as it relates to Medicaid spending. Part of our success is our ability within our long-term care program to deliver services to our members in a home and community-based setting because it costs about a third of what it costs to serve somebody in a nursing facility.
Betlock spoke at a panel on Capitol Hill this week to defend the use of waivers and promote state flexibility. But a recent Government Accountability Office report says there is not enough evaluation being done on the success or failure of the waivers. Catherine Iritani, director of healthcare at GAO, says the demonstrations are intended as research, and states like Arizona need to show results.
Evaluations are an important part of the use of the authority from the standpoint of actually learning from these demonstrations.
Betlock says the problem is the waiver process as a whole.
I guess it identified some concerns as it relates to Arizona's waiver. What I think it's really reflective of is the fact that the existing 1115 waiver process is broken and needs to be fixed by Congress.
Betlock says Congress should make Arizona's demonstration programs permanent instead of renewing them again and again.
It should be fixed to recognize the permanency of programs like Arizona that have successfully shown how they can use 1115 waivers to benefit the population that we serve and the taxpayers who pay for our program.
Reporting from Washington, Ariana Bustos, Cronkite News.